Started. My name is Allie. For those of you who don't know me, I am a doctor of physical therapy as well as a nationally certified Pilates instructor. I've been practicing here in the Boston area for the last 5 years and teaching with the Community Online Academy since it started back in March. So I know a lot of you guys have taken my classes before. This is my traditional back pain class. It is mostly movement based, so we're going to do some stretching, some strengthening. At the end today, we're going to talk a little bit about the timing of exercise and how and why you decide to do certain exercises at certain times. And then, as always, you guys know your backs better than I know your back. And so if something doesn't feel right, please take a modification. I offer a lot of different options for how to modify and when to modify and how to challenge yourself. So please take the option that feels right for you at the right time, and that's how you'll get the most out of this workout. So with that being said, we're gonna get started. You can bring your pillow with you and we'll head to the back to your mat to lie down and find a comfortable position onto your back. So I'm just gonna bring my pillow right next to me for the time being. Rest all the way down. You can keep your knees bent and feet flat if that's comfortable for you. And just take a moment to settle in and get connected to how your body feels on the mat today, especially if it's the first time you've been able to lie down. Let your shoulders relax, let your head relax. Feel the heaviness of both of your hips and both of your feet down onto the floor. As you lie here, we're gonna end up in just a second placing this pillow under your sacrum, but I kind of want you to feel where your sacrum is before we even put it there. And your sacrum is the flat bone that's between your low back and your tailbone. So just notice and feel that. It's right across the back of your pelvis. You may feel that heavy, or maybe it's curled a little bit in one direction or the other. So from here, we'll lift up and we're gonna slide our pillow under your sacrum. And notice it's not under your low back, really, it's underneath your pelvis. And then just rest your hips down. And this should feel fairly comfortable. It should feel like your hips are able to relax a little bit. It should feel like maybe your spine is able to relax a little bit. And the process here really is of decompression. So by getting our hips just a little bit higher than our heart, we are very, very slightly putting little bits of space between each vertebrae. Compression over the course of the day decreases that space, and that's mostly due to gravity, but it's also exacerbated by sitting. So just resting here, this is a nice, soft, comfortable position for our hips. Let's start to focus in on our breathing. Start to take big inhale breaths in, expanding your rib cage wide out to the side, and exhale, letting your breath go. Inhale to open your rib cage up, feel the ribs lift and expand, and exhale. See if you can get a little bit of that extra air out of the bottom of your lungs. Let your belly relax as you open up and exhale to release. And as you feel that movement through your belly, hopefully you also feel some of those tight muscles around your back gently start to release. And that's one of the benefits of this deep diaphragmatic breathing, is that our diaphragm is a muscle too. It is in our abdominal cavity, and that alters how the rest of the muscles in the area are able to work. So we'll try one more big breath here. And then let it go. You're gonna slide that pillow out from underneath your hips. Let your hips settle down for just a moment. And then we're gonna take that pillow, depending how thick your pillow is, I'm gonna actually fold mine in half and place it between my knees. Yours may be thick enough that you don't have to do that. And just firmly plant your feet down onto the floor. So we're going to talk about our hip flexors here. For those of you unfamiliar, your hip flexor is the muscle across the front of your hip. It lifts your leg. So if you place your hand right on the front of your hip and you lift your foot up a couple times, you're going to feel kind of a big tendon tighten up underneath your fingertips. That is your hip flexor tendon. Okay, so the reason we talk about it is because the hip flexor then actually connects all the way onto your low back. And I find that it tends to be quite overworked in many people, and it does think tasks that it really doesn't need to do. So we're going to try a little example here. What I want you to do is very gently just squeeze in on the pillow. So you're going to squeeze both knees together and then release. Try again, squeeze both knees together and then release. So as you're doing this gentle squeeze in and out, I want you to feel if your hip flexor tendon is working. It shouldn't be. This is an exercise for your inner thighs, but a lot of times I see people's hip flexors are firing even during an exercise like this. So if that's the case, see if you can tip your tailbone a little bit towards your heels. Continue that gentle squeeze in, but maybe make it a little bit softer. It doesn't have to be the hardest squeeze that you've ever done in order for this to work. And see if you can try and quiet down that hip flexor. If you can really just feel the inner thigh doing some of the work here. And really, this is more of a brain exercise than anything, just retraining that muscle to relax a little bit. Good. We're going to try 3 more here. 2 more. 1 more time. Good. Now gently hold in on that squeeze. We're going to take this right into a bridge. So you're going to lift your hips up and gently drop your hips back down. Lift your hips up and gently drop back down. So as you lift and lower your hips, this is using your glutes, your hip muscles. That is the antagonist, the opposite muscle of the hip flexor. And so oftentimes if you find that it's hard to get your glutes on, it's probably because your hip flexor is doing a little bit too much work. So this is a little trick I like to use, hugging in on that ball to deactivate the hip flexors and help you get better glute work. And we care a lot about glute work because that is what supports our spine when we bend over, when we pick things up, when we squat. Good. Try 2 more here. That's it. And last time, drop your hips down. Good. Okay, so take a quick rest. What we're going to do is take this into a little bit of abdominal work. And so again, in abdominal work, sometimes our hip flexors work, but they should work together with our deeper abs. Sometimes I see them working in isolation. So we're going to try, we'll remove the pillow just for a second. Press the back of your rib cage down into the mat. Lift both of your legs to a tabletop position, and then you're going to return the pillow between your knees. You can just kind of put it in the single way. See if you can find that gentle hug in here without using your hip flexors. And it's much harder in this position having your legs lifted. I like to imagine the entire leg sort of acting like a panini press to hug in on the pillow rather than just knocking your knees together. If this is too tricky, bring your feet down. Come back to that more basic version. Now, if you feel like you've got it, try pressing the legs out and bending them back in. So see if you can now keep that squeeze as you press the legs out, and just see how that sort of changes this traditional abdominal exercise. So maybe you've done this before. See what it feels like to really maintain that active squeeze in and when you pull the legs back. Good. 4 more. And 3 more. That's it. Last 2. Good. 1 more time here. Pull it back in and place your feet down. Take a little rest. We're going to set that pillow off to the side for a moment. This time we're going to try another abdominal exercise, but single leg. So you're not going to have the pillow there for that feedback, but I want you to imagine that it's still there. So you still have that gentle activation of your inner thighs. So arms pressed down. You're going to reach both legs up to the ceiling. You can keep a soft bend in your knees if needed. And from here, lower one leg down a bit. Lift it back up. Lower the opposite leg down. Lift it back up. So you can make this as big or as small as you would like. I want you to focus on trying to keep your spine nice and still. So there's not a lot of momentum. The space underneath your rib cage stays the same the whole time. 4 more. And 3. Good. 2. 1 more time. Good. Bend your knees in towards your chest. and gently rock from side to side. Excellent. All right, so roll yourself all the way up to a seated position. This time we're gonna flip on over to an all fours setup. And when you are in the all fours position, if you know that kneeling is uncomfortable, go ahead and roll up your mat a couple of extra times to give yourself some padding, and then lower onto your hands and knees. See if you can drop your shoulders away from your ears, lengthen through the top of your head, and then gently let your head round, drop down, rounding the spine up, and then drop your rib cage down to the floor, lifting through your head. Let your head hang down, lift up through the ribs, and drop the rib cage down, lift your head on up. Good, very gentle, nice and easy here. Lifting and lowering. We'll try 3 more. You can make this as big or as small as you feel comfortable with for 2. And 1 more time. Good. Now we're going to take this into a little upper back stretch by taking our pillow in front of us, lowering your forearms down onto the pillow. And from here, you're going to push back to let your head drop down, maybe even onto the pillow. And you can scoot your knees back, play around with this. I call this like a puppy dog stretch, the way a dog might stretch their paws in the morning with their tailbone up in the air. Now a little add-on to feel more of a stretch in your triceps on the back of your arms is to bend your elbows and tap them to the back of your head, and then really try and press your chest down to the floor. Now, part of the reason we stretch our upper back in this class especially is so that we take the stress away from our low back, because this is where we often tend to be quite stiff. We'll hold for another big breath in here. A big exhale out. And then press yourself on up to sitting. You can set your pillow down off to the side once again, and we'll come down onto the mat. So this time we'll lower all the way down. You can place your hands underneath your shoulders, separate your feet just slightly, and we're going to start to lift on up. So maybe you're comfortable lifting only your upper back. Maybe you're more comfortable lifting all the way into your low spine. So whatever works for your body, I want this to be comfortable. It should not be pinching or painful. And if it is, make it a smaller movement, but keep moving. Okay, it can be tempting to want to just hold this stretch. Keep moving up and down. My suspicion is that as you continue to move, it may become easier and more comfortable to get into that bigger range of motion. Good, Paul, that looks great. Drop your shoulders down away from your ears when you lift up. Good. Excellent, guys. Beautiful form here. 2 more times. And last one here. And gently lower all the way down. Good. We're gonna roll onto our side now. So I'm on my left side. You guys can find that to mirror me or do the other one. We're gonna do both, I promise. And go into another upper back stretch. So this time I'll take my pillow. My legs are straight. My head is resting down on my left bicep. I'm gonna bend my right knee, folding my pillow in half because it's relatively flat, and rest my right knee on it. So I'm bending that knee up, resting it down on the pillow. Okay, so we're gonna go into our book openings here. So you're gonna reach your right arm out in front of you to tap the floor, and then reach it back behind you. Now, I give you this pillow here as a guide. So if your knee starts to lift off the pillow, that means the stretch is going into your lower back, which is not a bad thing, but we are trying to target the upper back right now. So if you really want to isolate the stretch here, you want to go only as far as you can without bringing your right knee off the pillow. And challenge yourself. See if you can almost push down with your right leg to open up your heart to the ceiling with your right arm. And you may feel a really nice stretch here. This is one that can be difficult to isolate. And if you have shoulder sensitivity, you can always hold your hand on your chest and do the same thing. So it's an upper back movement. It's a rib cage movement. The shoulder is just an added benefit. So really push down into that right leg as though you're smushing the pillow down. See if you can open up to the ceiling. We'll try about 4 more here with a little hold. Good. And last 3. That's it. Good. 2 more. Good. We're going to hold the stretch open on this last one and just practice a little bit of that same breathing pattern. So push down into your right knee in the pillow, open the right arm out to the side, and imagine like you're breathing to puff up air into the right side of your rib cage. Taking those breaths in, and it might feel really tight and restricted here. That's okay. Send your breath into that rib as best you can for 2. And 1 more big breath here. And then gently close it in. You're going to take the pillow out. Now bend your left leg and straighten your right leg. So we'll take advantage of this position to do a little bit of side hip strengthening. So from here, really reach your right leg straight. Make sure your knee is totally tight and straight. And then start to draw some circles. Now as you circle, your whole spine should not be rocking front to back. You should be relatively still here, moving just inside your hip joint. And again, your hip is that ball and socket joint. So you can imagine that ball tracing around in the socket. Good. Go ahead and try reversing that direction. Same thing, reach back behind you, up and back behind you. Good. That's it. We'll sweep the leg around. 4 more. 3, 2. Last time there. Good. And lower down. This time you're going to bend the knee in. Press yourself on up to a seated position so that right now I'm sitting down on my left hip with my legs splayed off to the side. So we're going to take this now into a sideways stretch by placing the left hand down on the floor and reaching the right arm up and over. Return the right hand down, and then again, reach the right arm up and over. Think of arcing the right side of your spine up to the ceiling, like you're trying to make a rainbow shape with your right side. Good. Try 2 more just like this. Excellent. 1 more time here. Good. Now you can continue with this pattern if you would like, but if you want to add on, we're going to take it into a bigger movement. What it looks like is stretching your legs out, lifting your hips up high, and then lowering back down. Okay, that's totally optional. If you want to progress here and give that a try, you can certainly do that. You can also just stay with that gentle sideways reach. We'll do 3 more. Find that big lift up and lower back down. That's it. We'll try 2 more. Imagine painting that rainbow now with your right hand over your head. Good. And 1 more time. And then lower all the way back down. Very nice. We're going to swivel the legs around to the other side and grab your pillow once again so we can go down onto our right side upper back stretch. So make a little pillow with your bicep. You're going to straighten both legs away from you. Maybe take your pillow in half, bend your left knee, and place it down on the pillow in front of you. And again, you want to think of really kind of pressing that left knee down towards the floor, like you're having a little bit of support from that side. Taking the left hand up, you're going to reach out in front of you to tap the floor and then reach back behind you, but only as far as you can go without lifting your left knee off the pillow. And you might find one side is really different than the other. I know for me, this one is much tighter than the other side we just did. And part of that is because I'm right-handed, so I tend to be more flexible with tasks on that side. Good. Nice work here, guys. Again, because this is a stretch for your upper back, you want to make sure that you're breathing. You're not holding your breath here. And there's not really a right or wrong way to breathe, but you do want to make sure that you are continuing to let your ribs expand. That's actually going to help you to get a deeper stretch. Beautiful. We'll do 2 more just like this. That's it. And 1 more time here. And all the way closed. Good. So now you can remove your pillow. You'll straighten your left leg and bend your right knee. So now we're going to work on those side hip muscles again. So your spine is still when we start to draw circles. Now the reason we care about these side hip muscles is they are what balances our pelvis when we do asymmetrical movements, just like carrying a bag of groceries that's really heavy on one side. It's what prevents us from really throwing out our back on one side. It keeps us balanced. Good. And let's change direction, other side. What's tricky is that we don't often do a lot of sideways movement in our day-to-day life. So these muscles tend to get really, really weak when we're not actively training them. Good. We'll do 4 more. And 3, and those of you guys who have taken my Pilates class before, you know this is straight out of the Pilates repertoire, so I'm always a little biased that I like this one to help with side hip. Good. Okay, now bend both knees in. You're gonna press yourself on up to that comfortable seated position. You're sitting down on your right hip with your legs off to the side. And if you can't sit like this, you can sit in a cross-legged position, that's fine. You're gonna reach your right arm down towards the floor and dive your left arm up and over. And then left arm comes down, and again, reach your left arm up and over. You're thinking of now arcing the left side of your rib cage up to the ceiling. So it's as though the sides of your ribs are like an accordion. You're just letting it lift up and lower back down. We'll try 3 more here. Good. Last 2. Beautiful. 1 more time here. Good. Now we have that optional add-on for the bigger side plank. So if you'd like to try that on this side, you're going to stretch your legs out long, reach your hips up high, and then lower yourself all the way back down. Stretch out the legs, reach, push down into your bottom arm, and lower. Good. We'll try 3 more just like that. And lower down. Good. 2 more. Press out, up, and reach. And lower. Good. Last 2. Excellent. Come all the way down. And 1 more time here. Good. And lower all the way down. You can collect your legs in the center. All right, so we have 1 more stretch for class today, which is a hip flexor stretch. If you tend to be really uncomfortable with kneeling, you're going to use your pillow for this stretch. So I'll show you how. So we're going to come up to a kneeling position. And like I said, if you need your pillow, when you kneel, you're going to kneel with your knee cap off the front of the pillow. This is a little trick I like to use that you can now kneel and there's very minimal weight going into your kneecap now. Okay, so give that a try. I'm gonna take it out and show you guys. Now, once you're kneeling, walk your right foot forward. Try squaring off your hips to your right foot. So chances are you need to rotate your left hip forward, right hip back, push down into your right foot, lift your spine up tall. Now you may already feel a stretch in the front of that left hip, and if you do, cool, you get to stay here. If not, you're gonna bend your right knee forward until you feel the stretch in the front of your left hip. Now, if you've gone really far and you don't feel it, it's probably that you're no longer square. So think of pressing the left hip forward and picking your spine up tall. Tighten your core, tighten your left glute muscle, and that should help you to feel that right in the front of your thigh. So we'll just hold and breathe this for a moment. If you would like, you can lift your left hand up in the air to add to that stretch. You can even very gently bend to the right, and that's very gentle, very subtle. And then come right back down. We're gonna switch sides. I'm sorry, you guys can't see my head in that picture. I didn't even realize that I was cut off there, but you get the most important part. So this time, walk your left foot forward and work to square your hips towards the front edge of your mat. If you need to hold on to something here for balance, that's fine. Don't be afraid to grab on. It may help you relax a little bit into this stretch. So right hip forward, left hip back, spine is up nice and tall, and very gently lunge into your left leg until you feel that stretch in the front of your right thigh. Pick your chest up tall, tighten your right glute muscle, and see if you can hold, feeling that stretch in the front of your right hip. You want to think of, if your back is really arched, pulling your ribs in. That's actually going to help you get a deeper stretch here. As an add-on, you can reach that right arm up in the air and gently side bend towards the left. As one last little deepening of that stretch, and take another deep breath in, and then a deep breath out, letting it go. Good, and then you can gently come out of that stretch. All right, so nice job there. So the one other thing I want to go over with you guys today is the timing of your exercise program. So you've just learned a bunch of things that you can do to help strengthen and stretch around your spine, but when should you do them? And it sort of matters, it depends a little bit on your body. So I'm gonna make a huge sweeping generalization and put people into two categories. The first is the person, they go to bed, sleep fine maybe, they wake up in the morning and they're in a lot of pain. They're very stiff, it might be hard to get out of bed. That's what I would categorize in the more arthritic type of pain. And that type of patient, usually they feel crummy in the morning, but then they get going and everything starts to feel a little bit better. And so as you warm up, your spine moves a little bit better, and then you're good to go for the day. If you fall into that category, it's probably good for you to do this type of routine very early in your day, perhaps even before you go and have breakfast or something. That way you get the most out of your day in a pain-free zone. So if you can use this to get yourself moving early, that's awesome. Otherwise, we find that some people, they wake up in the morning, they feel awesome, everything's good, you're going about your day, and maybe by lunchtime, your back's hurting a little bit. Then by 5 o'clock, oh my gosh, my back's really hurting. And by the end of the day, your back is super, super sore. That is more of perhaps a disc issue or even, a muscle strain, signs that your body is getting tired, fatigued, or compressed over the course of the day. And so in that case, you want to try and take these little stretches and maybe integrate them throughout your day, but towards the second half of your day. So you could perhaps do a couple minutes of stretching at lunchtime and a couple minutes of stretching before you go to bed, trying to get ahead of that moment of pain that you're feeling. So if you know every day, okay, I'm good, but by lunchtime it really hurts, maybe at 11 o'clock you throw in 5 or 10 minutes of that stretching so you can get ahead of it, and then you've got a couple of more hours before your back starts to bother you.